Good afternoon. My name is Connie, and at this time, I would like to welcome everyone to the HIV Screening and Women's Health Curriculum Overview Training Exchange conference call. All lines have been placed on mute to prevent any background noise. After the speaker's remarks, there will be a question and answer session. If you would like to ask a question during this time, simply press star then the number 1 on your telephone keypad. If you would like to withdraw your question, press the pound key. Thank you. Ms. Steiger, you may begin your conference.
Thank you, Connie. Good afternoon or good morning, depending upon where you're calling from today. On behalf of the AIDS Education and Training Center's National Resource Center, I would like to welcome you to the HIV Screening and Women's Health, a Curriculum Overview Training Exchange. My name is Jamie Steiger, and I am Program Coordinator with the AETC National Resource Center, and I will be the moderator for today's training event. The curriculum that we will be reviewing today, members of the Curriculum Update Subgroup of the AETC Women's Health and Wellness Workgroup. As presented on slides 2, you can see that many people contributed to the development of this curriculum, including our colleagues from the Texas-Oklahoma AETC, Maytech, CTech, Healthcare Education and Training Incorporated, and the AETC National Resource Center. Our panel of final reviewers includes our colleagues from the following regional training centers for family planning: the Planned Parenthood of Indiana and Healthcare Education and Training Incorporated. The 2007 version of this curriculum is an update of the HIV/AIDS Case Finding and Family Planning Clinics curriculum that was developed in 2002 by Maytech and Healthcare Education and Training Incorporated. So many of you on the call may already be familiar with the 2002 version of our curriculum, and if so, during our question and answer session, we definitely invite you to share your experiences of using this curriculum in your settings. Moving along to slide 3. Part 1 of this training exchange will be the presentations. Our presentations will take about 20 to 30 minutes. We will provide an introduction to the curriculum and an overview to each section of the curriculum. Part 2 is our operator-assisted question and answer session. We have allotted quite a lot of time for the question and answer session to allow for a rich discussion on how to use this curriculum. It is also an opportunity for everyone on the call today to provide us some feedback on the curriculum. All participant phone lines will be muted until this question and answer session. Should you have any questions after the training exchange is completed, please contact the AETC NRC at info@aidsetc.org. We will make sure that your question is answered. Moving on to slide 4. The evaluation component of this program is critical. We use this information to improve our training skills and to ensure continuous quality improvement. Once the training exchange is completed, all registered participants will be receiving an email from me linking to our online evaluation form. Moving on to slide 5. At this time, I would like to introduce our presenters for today's training exchange. Dr. Laura Armas is our workgroup leader, and she will be providing a general overview of the curriculum. Barbara Scheckman will be presenting Section 1 of the curriculum. Tonya Poteet will be presenting Sections 3 and 4 of the curriculum. Karen Sherman will be presenting Section 6. I'll be presenting Sections 2 and 5. If you would like additional information about our presenters, please visit our training event webpage at www.aidsetc.org. I will now turn the presentation over to our workgroup leader, Dr. Laura Armas.
Hello, everybody. This is Dr. Armas. I would like to start by defining the objectives for this training event. If you're already on slide 6, you would see that the first objective is to identify the goal, learning objectives, and contents of the curriculum. What we mean, we want to share this curriculum to provide you with tools to give you trainings in women healthcare settings where they need to get more knowledge about testing and HIV in general. The second objective is to describe how the curriculum can be adapted and applied for various training audiences and venues. The third objective is going to be to recall the appropriate target audience and trainer for each section of the curriculum, and finally, to discuss how the curriculum was used in the past and how it can be used in future trainings, given the recent changes in the testing policies. The curriculum has 6 modules, 6 PowerPoint slide sets, with talking points. And if you already took the time to kindly visit the website and the link that was sent with the invitation, you probably already looked over these slide sets. And each slide set contains talking points to assist the training with the material on the slide. These talking points are intended to serve as a guide on what should be emphasized on each slide. We encourage each trainer to tailor each presentation to their own needs and the specific audiences they are targeting. Some of the information might seem to be repetitive in other sections, and that is to allow the comprehensive overview of each section in the topic. These sections were also developed this way to allow flexibility for the trainers who may want to use one or two sessions instead of the whole curriculum, depending on the timing that they are allowed to do it. Some of the modules include handouts that can be disseminated to the training participants at each event, and all the curriculum materials are available at the website, at the National Resource Center website, www.etc.org. And also they will be available in the future in a CD-ROM format if you so desire to request. The next slide, we're going to talk about the purpose of this curriculum. It is basically to promote early diagnosis and access to care for HIV/AIDS by encouraging education and HIV screening in all clients in the family planning clinics. The curriculum includes the following sections. Number 1, why test all our clients, which is a common question since many of the planning centers do not see the real need. The second section refers about the HIV prevention and test counseling with a client-centered approach. Third section, more detail about heterosexual transmission of HIV, followed by gynecological manifestations of HIV infection, as well as testing options. And finally, considerations for implementation of these trainings. The next slide is going to highlight some of the frequently asked questions when we provide some of these training exchanges. Number 1, how should I use this curriculum? Who is our target audience? Do I have to use all 6 sections? Can I adapt the slide set in this curriculum? How to provide feedback to the authors, and how can I contact? First of all, the family planning clinics are going to be the ones who have direct care responsibilities or direct communication with clients. Each presenter will talk more specifically about who the target audience is for each section. Using the sections, as I mentioned before, is not all mandatory. Actually, the sections were created in such a way that you can pick one or the other, or actually even mix some of the slides from the different sections and still look like one continuous flow, and that depends on your trainer's preferences. And that's how they can adapt each one of their own training events. If you would like to provide feedback, again, you can contact the National Resource Center at their website. And you can also find our information of all the authors if you have a specific question. I will now turn the presentation over to Barbara Scheckman. Thank you.
Hello, everyone. This is Barbara Scheckman. Thank you, Dr. Armas, for your introduction, and Jamie. Before I get started, I wanted to take a minute to thank Suzanne Karlberg of our staff here at Maytech for her work on this section and the original curriculum from which we worked. She'd put a lot of time and effort into it, and I certainly couldn't have done my section without her. The section that I was responsible for bringing together and updating was the first section, which is called Why Test All Our Clients. What we did was try to identify the rationale for testing in family planning clinics, and we've identified 4 major reasons. The first is that women who are getting services in family planning are, by definition, at risk, because in most cases they're coming to get birth control methods, meaning that they're having unprotected sex of some sort. So that's the first reason. The second reason is that there are way too many missed opportunities in the healthcare system where people have had an opportunity to be tested and for some reason they were not offered a test or given a test. The third is that knowing a patient's status is good for their health. And the fourth is that testing can be integrated into family planning services, and it's our sense of who else could do a better job with this sensitive topic than the folks who are already dealing with such sensitive topics as sexuality and birth control. Each reason that we've identified is then supported by background information. Much of the section is focused on the risk of women, the risk of young women, and then the risk of young heterosexual women, who are the main clients of most family planning clinics. The missed opportunities section focuses on studies that have shown that often people come into medical sites many times and don't get tested, even in some cases where they have what was defined in one study as an HIV, quote, trigger. So it's trying to identify for our trainees that they have an opportunity to stop the missing of opportunities and to take advantage of an opportunity instead. These two parts really make up 3/4 of the section. Then it's followed by the other two sections where we try to explain why it's a good idea to get tested and how it can help, if you are positive, to maintain your health, and also why we think family planning sites are probably one of the best places for this activity to take place. The target audience for this section is all clinic staff of the agency and others beyond the agency or others beyond the clinic staff itself, so administrative staff if they're interested. It can be used alone to bring the whole staff into the effort, and it really kind of brings the rationale and hopefully the mission of why it's important to do this kind of work in a family planning clinic. There are some slides that are a bit more clinical, such as those that discuss hormonal contraceptives and how they might increase HIV risk, but I don't think it's anything undoable for people without a clinical background. And there are extensive references at the end of the section so that anyone who wants more information on the data presented can do some follow-up of their own and get more material. It's my estimation that this section should take approximately an hour to present, making it a good size, I think, or time for a lunch or an in-service meeting of a clinic. And it's also our sense that ATC trainers or RTC trainers, clinical or not, can probably present this section with or without a clinical background. So with that, I'm going to turn the presentation now over to Jamie Steiger for an overview of Section 2.
Great, thanks, Barbara. One of the sections that I was responsible for updating with the group is Section 2, which is titled HIV Prevention and Test Counseling, a Client-Centered Approach. And this section includes 42 slides, and the approach that's featured in this curriculum is a client-centered approach as opposed to a directive counseling approach. It begins with an overview of the benefits of conducting HIV counseling in family planning clinics. In general, some of the benefits are that family planning clinic staff are comfortable talking about sexual behaviors, and clients coming to their sites are already concerned about preventing pregnancy or STIs, and they expect to disclose some of their sexual history to staff. In order to provide effective HIV counseling, the needs of the providers, clients, and the organization must also be addressed, and this is further discussed in this section. For example, an organization should have a policy requiring staff to offer HIV tests, and providers should be given training on women and HIV. This is followed by a comparison of client-centered counseling, which is interactive and uses open-ended questions and active listening, to directive counseling, where the counselor gives information and provides advice. These comparative slides are followed by slides on counseling techniques and principles, and it is accompanied by a handout that illustrates how questions are framed using each approach. So, like, for example, on this handout, an example of a provider-driven closed question could be, let me tell you how HIV is transmitted, and this is compared to a client-centered open-ended approach to asking this question, and that could be, tell me what you've heard about how HIV is transmitted. So there's several comparisons similar to that on how to frame questions on that handout. The trans-theoretical model for behavior change is presented in this section as well, and it features the 5 stages of behaviors change. Each stage of behavior change is presented in such that various roles that a counselor can play at each stage is reviewed. Following all of this background information in the slide set are 4 steps of providing general HIV prevention counseling, 4 steps in providing pre-test counseling, 4 steps in post-test counseling with a negative result, 7 steps in post-test counseling with a positive result, and 8 steps in counseling with an indeterminate test result. This section concludes with an overview of the typical services that an HIV-infected person may need and use. In terms of target audience, this slide set is appropriate for anyone who provides clinical care and/or prevention or test counseling services for women. The trainer should be somebody who is familiar with client-centered counseling principles and who has provided pre- or post-test counseling for women in the past. This section can be presented on its own or as part of the entire curriculum. Interactive exercises on active listening can be used to further develop client-centered counseling skills. So there's really some room to interject other training methods into this section of our curriculum. If your clinic currently does not offer HIV testing, this section can still be used, and information about pre- and post-test counseling can be eliminated. And I will now turn the presentation over to Tonya Petit.
Thanks, Jamie. Hi, I'm going to review Section 3, Heterosexual Transmission of HIV, which is presented on Slide 12. This section of the curriculum describes the route of HIV transmission in vaginal sex and is pretty biologically focused. It includes ways that HIV crosses the vaginal epithelium and the important role that Langerhans cells play in infection, as well as the role of progesterone. It also identifies the factors for increased susceptibility to HIV among women, including biological factors, such as physiological changes that happen with aging and changes associated with young women's cervixes, and also psychosocial factors. It goes on to discuss what's known about the risk of HIV infection during anal sex and during oral sex, and talks about the prevalence of these behaviors among heterosexuals. And finally, it reviews risk reduction methods for both sexual acquisition and drug-using acquisition of HIV, so it talks about ways to reduce risk in all of those behaviors. The target audience for this particular slide set is pretty much considered to be clinicians. While earlier slides are biological in detail, the majority of it can be appropriate for others who are not clinicians, including people who do prevention counseling. And I think the idea behind it was that for those who have a biological background, to provide that information, and for those who don't, to have sort of an overall broad sense of where the information comes from, and then to see how to apply that to counseling around specific sexual behaviors. The trainer should be someone who's comfortable with the science content and comfortable with discussing specific sexual behaviors. In terms of examples of how this section can be used, it could be used as a standalone training event of an hour or less, or a longer training that's followed by case studies or role plays or more detailed discussions. However, it could also be used in conjunction with other slide sets in this curriculum as part of a broader training on HIV and women's health. So it's a very flexible section. And moving on to Slide 13, I'm going to discuss Section 4, Gynecological Manifestations of HIV Infection. And this is much more biological, scientific section than any of the other ones in the curriculum. It describes the variety of gynecological problems that could identify women who should be candidates for HIV screening. So the approach is that while we're trying to encourage HIV testing of all women, that by going through all the different common gynecological manifestations in present that could be triggers for HIV, that by the end of the training, the participants will understand that this really applies to all women. And specifically, the section goes through abnormal intrauterine bleeding, recurrent vaginitis, genital tract neoplasia, accelerated progression of dysplasia, human papillomavirus, pelvic inflammatory disease, and genital ulcer disease. The target audience for this one is specifically clinicians who provide gynecological care for women. It's very, like I said before, biologically based, clinically oriented slide set. The trainer ideally would be a clinician who provides gynecological care for women and can speak from their experience. And this section could be used as standalone, but would probably work best as part of at least one other slide in the curriculum. For example, I could see Section 3 and Section 4 going very well together as part of a training set. And also the section on why test all of our clients would make a good sort of 3-slide set package for a longer training. It could also be used as part of general basic training or refresher training for women's health providers. And that's about it for the two sections that I worked on, and I will turn the presentation back over to Jamie.
Thanks, Tonya. Okay, moving along to slide number 14, and this is focusing on Section 5 of the curriculum, which is titled Testing Options. And this is actually one of the new sections that have been added to this curriculum since the 2002 version. And this was added because we felt it was important to present information about test options, as well as include information on how to select a test that is appropriate for each site. This section begins with an overview of testing history, and it includes an introduction to the 2006 CDC testing recommendations. This is followed by an introduction to testing techniques that are used in the United States, and conventional blood tests, conventional oral fluid tests, and rapid tests are covered in greater detail. This slide set concludes with key factors that commonly influence what test is selected in each site, and some of these factors could be positive predictive values of the tests, availability of lab services, training, cost of devices, quality assurance, and storage. The target audience for this section of the curriculum includes both administrators and clinicians who are interested in learning more about the current testing options. And the trainer should be an individual who is familiar with or has used various testing technology. This section can be presented as part of the curriculum in its entirety, or again, it can be presented as a standalone section. This section is a general overview of testing technology and merely provides an introduction to the many options that are available. Additional training for staff is necessary on a specific technology that is selected or used at your site. So it really is a great overview slide set of all the testing options and how to determine which test is appropriate. And I will now turn the presentation over to Karen Sherman.
Hello, everyone. In my overview, I want to give you a little bit of history on this section is Section 6, Considerations for Implementation, and we're on slide 15 now. Several years ago, a state health department in DHHS Region 5, which is the Midwest, the Great Lakes region. This health department mandated that HIV counseling and testing services be offered to all health department-funded family planning clinics. Those clinics included freestanding family planning clinics, Planned Parenthoods, and local health departments. And basically, what they did to get those clinics ready to do testing, HIV testing, was they trained the clinicians on client-centered counseling and the laws regarding HIV testing, and they thought, well, that's enough. After that, each clinic was left to sort out how the service of HIV testing could best be integrated into the organization and what the procedures should be. As clinics went along, they discovered they needed new procedures, they needed new protocols. They began to see and experience places where the laws on HIV testing didn't really work well with their traditional health care for women. And after about 3 years, the HCET began to work with a cross-section of those providers to articulate and document all the factors that they had to take into consideration and work through in order to effectively integrate HIV testing services. So by and large, this section is a result of the work with those providers. This section focuses on the processes and policies an organization needs to consider in order to ensure high-quality delivery of HIV education, counseling, and testing. If HIV testing is going to effectively be integrated, it needs to be mentioned in everything, from risk assessments to job descriptions. So you can't just train someone in how to do counseling, pre- and post-test counseling, and expect that to be an integrated service. You really need to begin to consider how HIV affects every aspect of your clinic. This section looks at the policies and guidelines discussed, and that includes state policies, Title X guidelines, and provides some general suggestions for what types of policies and organizations should consider or think through before they implement HIV testing. And let me give you an example of that. In one of the clinics we worked with, it was a very small clinic, as family planning clinics often can be. I think they have 1,000 patients. They had a client come in testing, tested positive. At the time, they were offering either anonymous or confidential testing, really looking at the laws more than reality, so that they thought that anonymous testing just meant it wouldn't go in the patient's chart. And, I mean, basically they knew the patient. When the test came back positive, they knew who the patient was, but they were pretty helpless to do anything about it, and the client did not come back for their test results. So it really put them in an awkward situation. So some of the things we consider is look at your services, look at the way you do business, and make your HIV services congruent with what's going on in the rest of your clinic operation. This section also provides resources for state policies regarding HIV testing and resources for referral for treatment. The target audience of this section is really management and administration. And by management and administration, it could be clinic management or it could be overall organizational management. The section really helps management and administration think through the issues they need to think through in order to, number one, increase other management buy-in for incorporating HIV into family planning, and maybe even increasing clinical and line staff buy-in. Probably the best trainer for this information would come from an individual that has had to work through these issues, or they've worked with other organizations that's worked through them, so they know what kind of issues come up. The best use for this section, we've found that using the section to help management think through maybe not necessarily in a training way. If it's a large organization, it may be training. But if it's a smaller organization, you may want to take the management staff through the sections step by step in sort of a technical assistance manner. With that, I'm going to turn it back over to Jamie, I believe.
Yes, that's correct. Thanks, Karen. And thank you to Dr. Armas, Barbara, and Tonya as well for your really helpful overviews of each section of the curriculum. I just wanted to mention one more time, because this was something that came up in several of the participants' pre-training exchange questions that we received from the registration forms. Several people asked how the curriculum is going to be evaluated, and we will have on our website, right next to where the curriculum will be posted, an online evaluation form. So we definitely encourage you all, as you're going out and using this curriculum, for you to revisit our website to be able to provide us feedback on what you thought of the curriculum, what you thought of the sections that you're using, and how you use each section of the curriculum. So we encourage you to do that after you use this. So I would now like to begin our question and answer session. And Connie, can you just remind us of how all of our participants can ask our presenters questions?
At this time, I would like to remind everyone, in order to ask a question, press star then the number 1 on your telephone keypad. We'll pause for just a moment to compile the Q&A roster. Your first question comes from the line of Lucy Bradley.
Hi.
Hi, Lucy.
Hi. I'm noticing on here that your slides are labeled as draft, and I'm wondering if it's okay to make sure that the LPSs in our area know about this and start using them, or if you're expecting that these will be turned into not draft at some time soon.
Yeah, we'll actually be sending out an email to all registered participants once every section of the curriculum is in its final format. Some sections are in draft format because we're just waiting for final approval to use some of the pictures that are within the slide sets. But we will alert you when the curriculum is in its final format, and we don't anticipate that any of the content will change unless, of course, we get some feedback on this training exchange about particular pieces that need to be added or removed from the curriculum.
Okay.
Your next question comes from the line of John Brown.
Hello.
Hi, John.
Hi. Thank you very much for the wonderful presentation. The slides look great. My question is a practical one. May these slides be shared with physicians who do an ID Fellows training and modified for their use?
Would any of our presenters like to speak to this question?
This is Tonya. As long as there's permission, I guess, from your end, Jamie, I think it would be an excellent addition to their training. I think it's a wonderful idea.
Yes, that's great.
And I'm going to speak, with my ATC limited knowledge of the policies. And I think some of the things that they talk about is in regards to, if you're an ATC person, is regarding to the PIFing or, using the personal identification form to count the people that you're training. I don't see why you cannot use them, but I think residents don't count. So you cannot just count that as part of the LPS training event, but there is no limitation on showing the slides to anyone that I'm aware. Dr. Pacheco is here and Deborah Phillips are here with me, and they're just nodding their heads that, it is okay to use them with residents. It's just you cannot PIF those. You can PIF the faculty if you are an ATC. Now, if you're not an ATC, I don't see why you cannot use them.
Thank you.
There are no further questions at this time. Are there any closing remarks?
I think we're actually going to post some questions out to all of our participants on the call. I guess we would love to hear from all of you who are on the call about how you would anticipate using this curriculum in your settings. As you've now been provided some time to look over each section, as well as you've been provided an overview of each section from our section authors, we'd love to hear from you about how you think you can use this.
Ms. Steiger, we do have another question.
Great, thank you.
Okay. It comes from Mr. Bernell Sims.
No, I just have a comment. It's very difficult to hear the speaker from Tanya, I believe her name is.
Tonya.
If she could speak up more so the audience can hear her.
Okay, great. Thank you for that feedback.
Thank you.
Thanks. This is Tonya. Is this better?
A little bit better.
Oh, I should shout.
Please feel free to dial in. I think is it star one, Connie?
Yes.
Star one, if you would like to share with us how you anticipate using this curriculum.
Okay, you have a follow-up question from Lucy Bradley.
Great, thanks.
Hi, just to start the discussion on how this could be used, I'm glad that John Brown is on this call because he's from New Mexico, where they're going to be implementing a project in the labor and delivery area to get more testing done. But several of our other sites are also going to be doing women-related projects related to testing, including Wyoming, who plans to do training and try to increase testing at every Title X site in the state, which is possible because in the whole state of Wyoming there's only 8 sites. But this looks like something that they could use to modify and figure out how to especially get the testing piece in there.
Great. Thank you.
Yeah. And can I respond to that a little bit? When we first developed the curriculum back in 2002, I think, or 2001, this is Karen Sherman, and I'm from the family planning side of the equation. And we developed this curriculum with Maytech. In the state of Illinois, which has numerous family planning clinics, we went out and made sure that, I think we went to 4 or 5 different sites and made sure that all of the family planning staff in Illinois were trained on this and went through the curriculum. So I think another opportunity is for the AATCs to get together, like you've just talked about, Lucy, with their family planning Title X training centers and offer training together. It's a great topic to collaborate around, and it really helps to have both groups present in the training.
Great, thanks, Karen.
Your next follow-up question is from John Brown.
Hi, thank you, and hi, Lucy. It was wonderful to sit in on this, and actually we will be using these in our, we're developing a program to encourage testing in the labor and delivery unit at the University of New Mexico hospitals, as they have approximately 150 patients a year who come in with no prenatal services and of unknown HIV status. So we're kind of doing a broad scope consciousness raising with staff, as well as getting involved in some of the technical aspects of getting the policies to allow for HIV rapid testing in labor and delivery. So this comes at a great time for us. Thank you.
Good.
Your next question comes from the line of Carol Peterson.
Great. Hi, Carol.
Hi, this is Carol Peterson, and I'm with Family Planning in Wyoming. So I'm really very interested in this curriculum. However, I'm kind of curious. We're a very frontier state, and so our agencies are spread across the state. And we have 8 delegate agencies, but we have a variety of satellite clinics under those agencies. A lot of our clinicians are part-time, and we have significant challenges in trying to get people together in a central location to do training. So I guess my question is, would there be an option through AETC to use these sort of as monthly conference calls where the slides are provided to people, but we get everybody on the phone, using this curriculum out over several months?
Would any of our presenters like to comment or respond?
Well, Jamie, I think what she's talking about sort of feeds into something we talked about the other day, and that's taking this curriculum and putting the voice into it, recording the audio to each slide presentation so that it could be used that way, and then you could have, we've used it a lot for audio conferences in DHHS Region 5, so it's very usable that way, but what we might want to do is put the audio into it that is the background behind the slides, the talking points, and then see how that's usable. Does that sound doable for you in Wyoming?
Yeah, because that would be a challenge. I mean, I think the curriculum looks great, but we don't really have the expertise in-house to walk all of our agency people through this. I guess the only thing that would be lacking there is the opportunity to ask questions and answer them. But, yeah, that would be very helpful. And I see that as being maybe more of an option, like I said, rather than trying to bring everyone together, because that's just nearly impossible for us to do sometimes.
And I think you get more bang for the buck if you do it with a group of people that are from the same agency. So if you get 5 or 6 people from one agency around a telephone, you get a little bit more moving in the organization.
Right. We just get a lot we have much more success with getting people on the phone. They can carve out an hour or so,
Right.
To do that on a regular basis rather than travel 400 miles. So, yeah, we'd be very interested in something along those lines, yeah.
Your next question comes from the line of John Brown.
Hi, John.
Hello, I just wanted to let everybody know that I was not disconnected. And I've been listening in just fine. Thank you. That's all.
I'm glad that we didn't lose you. Any other feedback about how you think you might use the curriculum?
Your next question comes from the line of Lucy Bradley.
Hi, just to follow up on, and I'm sorry, I'm really bad with names. I'm forgetting the name of the woman from Wyoming. Our local performance site in Wyoming is led by a woman named Anna Kinder, and she's just working on starting to develop a project to work with all the Title X sites. And I'm hoping that as soon as the slides are available, we will get these to her. I think a different option for using these slides in a telephone-type presentation rather than a recorded message that you then go through the slides as you listen to the recording would be to have one of our experts in the area be on the phone with people and go through the slides with the people who are on the other end of the phone, which would allow for some question-answer and would also allow for the presenter to tailor the presentation to the needs of that agency under whatever conditions there are related to that particular agency. So I could see a variety of ways. If there's an audio portion with the slides, that would be great, but I also think there's an advantage to using local experts in the area. And if we can't find somebody in Wyoming, although I think we can, but if we can't find somebody in Wyoming, we could have somebody from one of our other sites be on the phone with the people from Wyoming to do the presentation.
Great. Thanks, Lucy. Yeah, I think that, as Karen mentioned earlier, this curriculum really lends itself to a great partnership between the AETCs and the RTCs to deliver training. So
I was just talking before this call to Dr. Pacheco. Next week we have our face-to-face meeting with all the LPSs. So, what we're going to try to do is to disseminate this curriculum so they can train their own local trainers on this curriculum and then adapt it to their own needs. The people in the border can put their own flavor to it. The people from Oklahoma who deal with a lot of American Indian communities could also do that. So I think it is very pliable when it comes to adaptation to other settings.
Your next question comes from the line of Ben Nash.
Hi, Ben.
Hello. I'm at the University of Mississippi in Jackson, and I'm a perinatal consultant for the Delta region AATC, and I have two women's health conferences coming up in the spring, one here at UMC and one in northeast Mississippi at Tupelo, and I'm very pleased with the clinical content of the slides and plan on using it in those presentations.
Great.
Thank you.
And Dr. Armas also coordinates, I believe, a women's health conference in the Texas-Oklahoma region as well.
That's correct. It is April 27th to the 30th? And our previous meeting was the planning meeting for that conference, and more information to come on it. And we're going to try to present the parts of the curriculum there as well.
Great.
Your next question comes from the line of Charlotte Gish.
Hello, everyone. I work in the Health and Human Services Regional 6 office in the Office on Women's Health, and I really am enjoying reviewing the curriculum and think it has a lot of applications with other agencies that would also like educational training. I was thinking along the lines of our community health and migrant centers that are located throughout the United States, and also, as the one speaker said, our Indian health clinics. They're always looking for ways to continue their educational endeavors as well. So I think this is going to be really wonderful, and I plan to use it in our prison system in Texas. We have a peer education program where we do a conference each year behind bars, and I'd like to use parts of this when it's available.
Great, thank you. It's so great to hear that how versatile the curriculum is, and that it can really, while it's intended to be used to train individuals in women's healthcare settings, it really more broadly sounds like you will all use it in various settings, so that's great.
There are no further questions at this time.
Okay. I would like to also put one more question out there to everybody who's on the call today. As I mentioned earlier, we do have the flexibility to incorporate and edit the current status of this curriculum at this point. And so I'm wondering if anybody on the call has any input for us about pieces that you feel like we maybe missed or things that you think could be added or deleted from the curriculum. Is there any feedbacks that all of you on the call have for us as we're really getting the curriculum into its final format?
There are no questions at this time.
We did a good job then. Okay, are there just any general questions or feedback or comments that anybody would like to share? I'd just like to provide one more opportunity for that.
There are no further questions.
Okay, great. Well, thank you to everybody who's on our conference call today for sharing how you'll be using this curriculum, as well as for the questions that you posed to our presenters. Again, if you think of a question after this training event, please feel free to contact us at info@aidsetc.org. And if it's a question that we at the NRC can't answer for you, we'll be sure to direct you to the module authors for each section of the curriculum. Also, I just wanted to remind you that we will be sending out a link to our online evaluation form shortly after the conclusion of this training exchange, so we encourage you to complete the evaluation form. We look forward to your feedback always. But I would like to thank you for participating in today's training exchange, and we hope you have a great day.
Thank you.
Thank you.
This concludes today's HIV Screening and Women's Health Curriculum Training Exchange conference call. You may now disconnect.